Hi, my name is Nuha Salam, and my presentation is on a project I've done where I used artificial intelligence to detect platelet disorders through bruising. And this is under the broader global health goal of making healthcare accessible for all. Now, before going into this, I want to quickly talk about myself. I am a rising senior at Shrewsbury High School, interested in health equity. I am a 3-time national finalist in speech and debate, a public health policy intern at Harvard School of Public Health, and I've been a research intern at UMass Medical School and Harvard Medical School, along with a couple of other things. I also wanted to briefly bring up a quote, which was a guiding principle throughout this project, which is healthcare is a necessity, not a luxury. Now, this project was actually inspired off of a personal experience. I was born in Dhaka, Bangladesh, and I lived there before moving to the US. And while I was there, I was diagnosed with an autoimmune disorder called immune thrombocytopenic purpura. Now, the issue was, Bangladesh is a developing country where healthcare is not only expensive, but often inaccessible, and also not of the best quality. And because of that, doctors misdiagnosed me multiple times, especially because of the subtle symptoms. And I wasn't properly diagnosed, and by the time I was properly diagnosed, I almost fell under a coma. And that is something which absolutely should never happen. And that made me realize that millions of people lack the access or tools to catch these serious and rare disorders early, and this is especially found in developing countries. And also, in platelet disorders like ITP and leukemia, they're often misdiagnosed due to symptom overlap with normal bruising. Access to diagnostic tools like blood work or bone marrow biopsies are often needed to diagnose these diseases correctly and are limited in low-resource areas. Without diagnosis, these conditions can escalate to life-threatening internal bleeding. In fact, 1 in 7 ITP cases result in misdiagnosis. I also wanted to quickly talk about thrombocytopenias in particular, as these can often be associated with leukemia or lymphoma or other blood cancers, or can be their own diseases like an ITP. Now, thrombocytopenias are when there is a lack of platelets in the blood. Platelets are a cell in the blood which are responsible for clotting the blood whenever there is a tear in the vessel. However, when there is a lack of platelets, it leads to the body being susceptible to severe bleeding. And the only symptom for this is bruising. Now, the issue with bruising is that bruising can be trauma-related. If I hit my arm onto a table, there'll be a bruise there. So how are we supposed to distinguish between trauma-related bruising and then disease-related bruising? And this is something which often requires medical need and professional help, but half of the world's population lacks access to essential health services, and this makes it especially difficult for patients to realize that they have concerning symptoms because they need medical help and professional advice to diagnose this, and that is where the real issue emerges. And that got me thinking, can we teach a computer or artificial intelligence to see what the human eye might miss? With the rise of artificial intelligence, this is something which came into my mind, and that's something which this project explores. This project explores the use of AI to distinguish between normal trauma-induced bruising and bruising caused by platelet disorders. And the goal was low-cost, accessible early diagnosis, available especially in areas with limited medical infrastructure and in developing countries. Now, why could this work? Well, 60% of the population has access to technology, which makes this one of the most widespread forms of media and platforms, which makes any solution here very accessible, solving this issue with healthcare accessibility. On top of that, previous uses in AI for diagnosing other diseases have achieved high rates of accuracy with 80 to 95% accuracy, and both of these statistics is what makes this a really feasible solution. Now, what is convolutional neural networks, or CNNs? Well, these are a subset of artificial intelligence, and it's a deep learning model aimed to mimic the human brain and image recognition. What it does is it breaks images into feature maps and learns to detect patterns and structures across multiple layers. It's commonly used in cancer diagnosis and retinal scans, but not yet in bruising for thrombocytopenias, and that's what makes this a novel solution. So that leads into data collection. I collected between 200 to 300 images from online medical image repositories and categorized them in groups of petechiae and purpura, which are specific images of bruising related to these diseases or associated with these diseases, versus normal trauma-induced bruising. Now, the issue was that data was limited. Usually, to train these models, you'll need thousands upon thousands of images, but since this was a rare disorder, there were limited images, and there was also issues with quality, and this image consistently posed a major challenge to the model learning, hurting its accuracy. But still, I worked past that, and I began developing it. On the right is a model of what the final model looked like, but I used TensorFlow, Python, and Keras via VSC Code. And I standardized image size to 64 by 64 pixels and batch size to 60 to 32. And then I augmented the data and created 7 CNN models with varying architectures. And the goal was to identify the structure which yielded the highest accuracy. And here are the results. On the left are the accuracy tracked across the various models, and on the right are both the correct and incorrect prediction rates across the various models. For the results, Model 7 had the strongest results with test accuracy of 72.69%, which is a high consistency. On the slide is the CNN architecture and the different layers which were used, and I decided to turn it into a prototype app which would use data from the user through a survey such as age, location of bruising, and gender to further help with the final classification. So what the user would do, the user would submit a picture of their bruising and then submit their data, and then the app would classify it using the AI model and the data that they submit into categories of either a concerning symptom or a normal symptom. And this was aimed to help the user realize when they should seek medical attention and when their bruising is indicator of a concerning disease. As a conclusion, AI is not just for wealthy healthcare systems. It's something which could actually be used to expand healthcare accessibility and have low-income countries get healthcare access. This way, we can bring healthcare to everyone. And then briefly, a call to action. What can you do to support global health? Well, you can support, invest, and advocate and join initiatives that eradicate these barriers. You can join your free clinic, volunteer, and invest in initiatives like telemedicine or AI projects which aim to bridge these barriers. And then here are my references. Acknowledgements go to my family, this conference for this amazing opportunity to speak, my school's research methods program, and you for listening. And thank you. If you have any further questions, please contact my email listed on the page.